This is the lab interpretation guide for the Destiny Well cardiovascular profile. At Destiny Well, we define laboratory ranges in a sophisticated way. We use the standard ranges, represented by the blue bar here, from each reference lab that does a particular test to define the lab high and the lab low. If you have thyroid test results that are too low based on the lab's formal norm, then you have a diagnosis of lab low thyroid function or hypothyroidism. Similarly, for glucose, if you have a lab high blood sugar of over 126 on 2 occasions, then you meet the formal diagnosis criteria for diabetes. That's needed to make a medical diagnosis. But at Destiny Well, we think that there can be a lot more nuance. We believe that there's often an optimal range based on what we've found going forward helps people to live the healthiest lives, to be the healthiest, and to avoid disease. We triangulate this with the medical literature, with other people's standards, with our clinical practice experience, and all the different data points we can get, so we can come up with what we believe is optimal for a particular test result. Destiny Well also, in the red bars here, will define a Destiny Well high and a Destiny Well low. These may or may not line up exactly with a laboratory high or low, because sometimes we think that the range can be higher or lower, or that it needs to be different. And in between the optimal and the green bar and the low and the high in the red bars, we have orange zones for moderately high and moderately low. They're not quite optimal, but they're not in the high or low zone. In addition to learning things from the individual values on the lipid panel, we also learn things about their relations. So for instance, high triglycerides are often associated with low HDL cholesterol. This happens when a person gets metabolic syndrome and they get insulin resistance. They get increased VAT or visceral adipose tissue around the abdomen, and their waist circumference goes up. It's also associated with elevated blood pressure and elevated blood glucose. Similarly, high carbohydrate diets will lead to elevated triglycerides, but they may also increase LDL particle number, which is very damaging. So from the overall panel, we can tell things about the individual tests, but we can also look for patterns that are associated with cardiovascular and other problems when they occur together. Total cholesterol is the sum of all the different types of cholesterol: the LDL, bad cholesterol, the HDL, good cholesterol, and other fractions like IDL and VLDL cholesterol. These together comprise total cholesterol. Cholesterol serves a number of functions in the body. When it goes up, it sometimes is an inflammatory reaction, and the cholesterol is buffering and protecting the body from oxidative damage. Cholesterol is also important for the synthesis of hormones. It's the precursor for them, and also for things like vitamin D, which are steroid-related molecules that the body can synthesize in the presence of sunlight. We set our cholesterol norms a little higher than some people. We think that our laboratory partners range of 0 to 200 is fine, but our optimal range we believe is in the 150 to 200 area. This gives you enough cholesterol for your membranes to function, enough to use as hormone precursors and to make vitamin D, but not too much. We think that 201 to 239 is mildly elevated, and values over 240 are generally elevated to the problem range. Similarly, 111 to 149 is in the mildly low range, and we call cholesterol less than 110 too low, because you're probably in a range where you're not making enough steroid hormones, your membranes may not be as healthy, and you can get into other problems. Triglycerides are another fat in the blood. They're closely tied to your sugar metabolism. The normal for our laboratory partners reference range is 0 to 200. At Destiny Well, we like an optimal range of 60 to 100. Triglycerides are important for your fat metabolism. Values over 100 are associated with increased problems, and your HDL good cholesterol is often going down when that happens, and we call greater than 150 abnormal, as do some of the other major medical societies and groups. Values of 36 to 59 are mildly low, and when your triglycerides get less than 35, then they think they're too low, maybe representing some problems with your metabolism. So carbohydrates and alcohol raise triglycerides substantially. Sometimes the high triglycerides run in families. And then if your thyroid function is out of balance, if your thyroid is too low, your triglycerides will often go up significantly. And if your thyroid function is too high, if you have hyperthyroidism, then your triglycerides may actually go down lower than you want them. LDL cholesterol is called bad cholesterol. LDL has been associated with a lot of cardiovascular risk, and many times LDL is what's targeted for therapy with drugs like statins or from diet and other programs. Our laboratory reference range is from 0 to 160, and at Destiny Well, we think somewhere in the 70 to 120 range is optimal. On the lower side of that, if you have many risk factors or you've had previous cardiovascular problems, and on the higher side of that, if you're not having problems. We think less than 40 is too low, where you may not actually have enough cholesterol to synthesize things like vitamin D and to keep your membranes healthy. And then over 160 is definitely too high. We call 121 to 160 moderately high and 40 to 69 moderately low. Now, how your LDL relates to your overall health not only has to do with LDL itself, but it has to do with the condition of LDL, whether the molecules are oxidized and more damaging, or whether the LDL particles are big or small. And some of our other calculations and our other profiles will get into that. But these are the ranges that we set. You should know that if you have advanced cardiovascular disease, if you've had a heart attack, if you have multi-vessel disease in your heart, then your cardiologist or we might say that even lower ranges are appropriate to get down under 70 or down under 60. So those are considerations sometimes managed by specialty physicians, and they're outside the realm of what we generally talk about here at Destiny Well. But you may see other people recommending this for good reason, and that would be something to work with an individual physician on to find out what's best for you. HDL cholesterol is also called good cholesterol. The values of HDL are different in men and women, and in men, the normal laboratory reference range is anything above 40. They don't really define a too high range. At Destiny Well, we think values around 60 to 90 are probably optimal, and 41 to 59 are only moderately low, and many people are okay in this range. When you get below 40, you definitely have increased risk. HDL molecule takes cholesterol back from the blood vessels in the body to the liver for reprocessing. So it's a way to keep cholesterol from building up. Values over 90 sometimes could potentially be a problem because we're finding out that sometimes people don't clear HDL from their system. So once it's filled up with types of cholesterol that are supposed to go back to the liver and get reprocessed, instead of actually having receptors and going into the liver, it's circulating around and around. So values over 90 look like they may be associated with dysfunctional or not fully functioning HDL in some people. So we think that up to 90 is probably good for most people. Over 90 raises that question about whether the HDL is functioning normally. But values under 40 are definitely a significant problem. In women, HDL performs that same function of taking cholesterol back from the body and the blood vessels to the liver for reprocessing, but the values are slightly different. In women, the HDL should be over 50. We still believe the 60 to 90 is the optimal target, and 50 to 59 is in the mildly low range, with values over 90 possibly indicating dysfunctional or not fully functioning HDL, where it's high in the bloodstream, but that's because it's not being cleared and doing its job of taking cholesterol back from the body to the liver for processing. Non-HDL cholesterol is a calculated value. It's a simple equation subtracting the HDL good cholesterol from the total cholesterol. It also, in addition to the LDL bad cholesterol, includes fractions such as IDL and VLDL, intermediate density lipoprotein and very low density lipoprotein. Both of these are very high risk for cardiovascular risk and are damaging to the heart and blood vessels. The calculated normal for this is between 0 and 190 for a non-HDL, but optimal at Destiny Well is in the 100 to 130 range. Values of less than 100 may indicate that you don't have enough total cholesterol to help your membranes and your hormone synthesis. 131 to 160 is mildly elevated, and values over 160 probably are higher risk, and so Destiny Well has set their too high range at anything over 160. The triglyceride to HDL ratio is another calculated ratio that we find to be very valuable. Values over 4 are considered to be laboratory high. But we've also found that setting the values lower is helpful. Our optimal zone is 2 or under, mildly elevated 2 to 3, and elevated greater than 3. If your number is greater than 1.5, it predicts that your LDL particle size is going to start to go down. Smaller LDL particles infiltrate the blood vessels and cause disease more readily than larger LDL particles. So this is a way to get a glimpse at your LDL particle number in addition to ways that would measure it directly in more advanced profiles. We really want this ratio down around 2 or less, and over 3 is clearly associated with increased risk of heart and blood vessel disease. At Destiny Well, we've been extremely fortunate to find some amazingly good coaches, people with backgrounds of success in varied fields who bring all sorts of resources and talent and skill to help you. These folks have many years of clinical experience, and they know how to be of assistance at every step of the way, from motivation to connecting you with the right resources to finding things that you need to get you on your journey. To learn more, go to destinywell.com/coaching to meet our team and find out how they can be of service to you.